Critical colon cancer symptoms you should never ignore. Why is the incidence of cancer, especially colon cancer, growing among younger individuals as well as among the elderly? Let's investigate this alarming trend now and start a fruitful discussion. There includes a list of the most typical symptoms of colon cancer that you may be experiencing, so be sure to watch through to the finish. One of the most deadly illnesses in the modern world is colon cancer. It is the second most deadly kind of cancer and the third most frequently diagnosed. The battle against this illness is made even more difficult by the powerful business that has grown up around it. This industry is fueled by money, deceptive advertisements, and so much conflicting information that it leaves patients and medical professionals perplexed and frequently in error. It's a frequent misperception that heredity plays a major role in determining your risk of colon cancer. Although a family history, which accounts for 5 to 10% of instances, can raise your risk, this is by no means the whole story. Our lifestyle choices are what pull the trigger, even though our genes may load the pistol. In light of this, contemporary research is emphasizing more and more how important nutrition and lifestyle choices are in preventing or even curing the illness. For example, foods high in antioxidants are now recognized for their ability to combat a number of chronic illnesses. This is not just conjecture. It is a rapidly expanding field of scientific study that demonstrates the direction that medicine is heading. How can one determine whether they have colon cancer? What are the initial signs and symptoms? Which signs point to the disease's advanced stages? How can it be identified early? Who should have a colonoscopy and what is it exactly? Describe intestinal polyps and explain how they can be stopped from developing into cancer. Above all, is it possible to avoid and treat this problem naturally? Despite popular belief, this kind of cancer frequently goes undetected for years at a time. Usually it begins as a little polyp on our intestinal wall that grows slowly. It doesn't cause symptoms in the early stages since it takes up very little room and doesn't affect the contents of the intestines. Therefore, a colonoscopy is recommended for those who are at increased risk, particularly those who are over 45 or 50. If you have first-degree relatives who have experienced cancer, the advice is even more urgent. Polyps can be seen, found, and removed via a colonoscopy. The location and size of the tumor frequently affect how symptoms manifest. It's interesting to note that colon cancer that develops on the right side of the gut can be harder to spot. This is because the gut hasn't yet absorbed all of the water that is flowing through, which is why the feces are still liquid at this point. Therefore, unless the tumor is well advanced or has spread to other organs like the liver, bones, or lungs, it is difficult for it to clog the intestine at this stage. A hint for early detection is as follows. Tumors frequently bleed because of their haphazard growth. The problem is that there is no visible bleeding. Finding concealed blood and feces samples is one early detection technique. A sample of stool is collected and sent to a laboratory for examination. For early detection, colonoscopy is also useful, but be aware of these warning indicators. Iron deficiency anemia can be brought on by prolonged bleeding. You should be checked for an intestinal tumor if you are between 45 and 50 years old, appear paler than normal, and have iron deficiency anemia. Stool can occasionally seem darker because of slightly more severe bleeding. Let's now examine colon cancer that develops on the intestine's left side. Compared to the right side, the feces are already solid and contain less water, so obstructions or intestinal occlusions occur earlier here. What symptoms could someone encounter then? A shift in bowel habits is one typical sign. Let's say you typically use the restroom once every 2 or 3 days, or every day. You should be suspicious if you have been experiencing increased constipation lately, such as going a week or 2 without having a bowel movement. In some cases, the fecal matter's form could alter. As it moves through this section of the gut, it may get thinner. As an alternative, you can alternate between constipation and diarrhea bouts. Since many people have persistent diarrhea, doctors may think about doing a colonoscopy to look for intestinal tumors. The tumor creates an image on an X-ray that looks like a bitten apple when it reaches an advanced stage. In particular, this picture illustrates how the tumor has caused the intestinal lumen to narrow. Feces struggle to move through this constricted area as a result, and the tumor may also result in hemorrhage. Here, the blood is frequently bright red and apparent. in contrast to the earlier stages when the bleeding was concealed. Similar to right-sided colon cancer, the presence of blood may also make the feces appear darker. Abdominal pain from obstruction-induced gas buildup, abdominal edema, weight loss, exhaustion, and persistent weariness are additional signs of more advanced cancer. Internal organs may also experience symptoms such as metastasized liver discomfort or dyspnea if the lungs are impacted. The following information on early detection of this problem, and more significantly, natural prevention, is therefore essential. What are intestinal polyps? And these are usually asymptomatic, benign, tiny tumors that dangle from the intestinal wall like appendages. Detecting them is best accomplished via a colonoscopy. In addition to seeing the polyp, this treatment enables its removal and submission for laboratory examination to ascertain its benign or malignant nature. The caveat is that a tiny proportion of these benign polyps have the potential to develop into cancer over time. The main takeaway from this video is this: what elements contribute to this transformation? It is a result of both our lifestyle choices and our genetic composition, as was said at the outset. Our genes are not fixed despite what was once thought. How can intestinal cancer be prevented? According to recent studies, our dietary decisions, from what we buy at the grocery store to how we prepare it, have a significant impact on our health. In fact, gene expression can be influenced by a healthy diet and other lifestyle choices. In particular, making healthy decisions can reduce the activity of genes linked to cancer, heart attacks, obesity, dementia, and chronic inflammation. Conversely, bad behaviors and poor food choices might increase the activation of these same genes. To put it simply, this might hasten a polyp's development and in time cause it to develop into a tumor. Risk factors for colon cancer. What causes a polyp to become into cancer more quickly? This is caused by a number of things, including highly processed foods, too much red meat, particularly processed meats like salami, ham, and sausages, unhealthy fats, too many vegetable oils, apart from olive oil and a few others, sugar, and too much sodium. These compounds are like adding gasoline to the fire of tumor growth, especially when they originate from highly processed diets. For a while now, ultra-processed foods have been formally identified as carcinogenic. Chronic inflammation, poor or insufficient intestinal flora, microbiota, and constipation are other contributing factors. Additionally, it is well established that certain behaviors such as smoking and drinking alcohol can cause cancer. Foods and habits to prevent colon cancer. A diet high in antioxidants and anti-inflammatory foods is recommended to lower the risk of colon cancer. This includes colorful fruits and vegetables that are eaten on a daily basis. Turmeric and other spices have strong anti-inflammatory and antioxidant properties. It is also advised to consume healthy fats like omega-3s, which can be obtained from plants like chia, flaxseed, and sesame, or from fish like salmon, tuna, sardines, and anchovies. Healthy fats can also be found in avocados and eggs from free-range chickens. Another strategy to lower the risk of cancer is to treat constipation. In addition to increasing gut flora, drinking adequate water and fiber can aid in this area. Increasing social contacts, exercising, and getting enough sleep are other healthy lifestyle choices that are sometimes disregarded but have anti-inflammatory and antioxidant properties. For intestinal health, foods like nuts and seeds, including pumpkin seeds, are especially advantageous. Let's now discuss diverticulitis and diverticula. If you have these problems, you might be wondering if you can eat nuts, seeds, and the hard outer coats of some nuts and seeds. Yes, is the response. A thorough study that included over 47,000 patients revealed that eating these items does not raise the risk of diverticulitis or its side effects, including bleeding, unlike what many people believe. Therefore, avoiding certain foods is no longer advised for patients with diverticulitis. Conversely, these meals can enhance gut function and bacteria, and they may even help prevent colon cancer. However, every situation should be assessed separately, so speak with your physician if you have any digestive problems. What is a colonoscopy and who should get one? One medical procedure used to identify colon cancer early is a colonoscopy. A lengthy tube with a camera at the end is sent through the anal area and into the intestine during this procedure. In order to find anomalies like polyps, tumors, or lesions, the camera moves along the whole length of the gut. If a polyp is found, it is removed and submitted to a lab for examination to identify whether it is cancerous or benign. Most people don't feel any discomfort throughout the treatment and frequently don't even remember it because it is done under sedation or moderate anesthetic for their comfort. It is generally advised that everyone begin having colonoscopies when they are 45 or 50 years old. However, you may need to start tests sooner if cancer runs in your family. Generally speaking, follow-up treatments are performed every 10 years, unless your doctor specifies otherwise. Even though the operation is thought to be safe, there are a few possible hazards like bleeding or intestinal wall damage, although these are uncommon and very small. Thanks for watching.